Okay, hello everyone. We are going to do today skull. So last class we finished frontal bone, parietal bone, occipital bone, temporal bone. So we did last class 4 bones. So this class we are going to do the sphenoid and the ethmoid, and that is going to finish up the skull. And then we will do the facial bones, and then we'll do the mandibular bones. Okay, so I am going to open up the handout, and you can see right here on the handout that we did frontal, parietal, occipital, and temporal, and that was under the cranial bones, right? Today we are going to do sphenoid and we are going to do ethmoid. So in sphenoid, we are going to do sella turcica, greater wings of sphenoid, lesser wing, optic foramen, superior orbital fissure, inferior orbital fissure, foramen rotundum, ovale, lacerum, spinosum, medial and lateral pterygoid. So it has quite a few things in there. So let's look at our PowerPoint, and we are going to go to the skull. Okay, you see the yellow bone right here, a little part of it. That is your sphenoid bone. And it looks very small, but basically it is a big bone. So we are going to look underneath the skull. This is front because you can see the orbits. Now let's look underneath the skull where you can look at the teeth. So this is the upper jaw and it's underneath the skull. You see this bone right here? When you look at it, it somewhat looks like a little butterfly. And this is your sphenoid. Know the spelling. This is sphenoid from the bottom of the skull. Now, do you see this structure right here and this structure? These are two plates. So not in the midline, not in the midline, but these on the sides, these plates that you are looking at, these are your pterygoid plates. So the one closest to the midline, which is your this one right here. This is your medial pterygoid plate. The other one is your lateral pterygoid plate. Okay? Now, let us look at another photograph as well. So I am going to go to the Google and do pterygoid plates. Okay, so here, if you look at it, right here. This is, now follow my cursor. You see this in the middle? Not this, but see this one? This is medial pterygoid plate, and outer to that, look at my cursor, that is the lateral pterygoid plate. Okay? The same medial and lateral pterygoid plate. The next thing we are going to look at is foramen ovale and foramen rotundum. You can see it from both sides. I'm going to show you on one side. You see this oval shaped foramen ovale. You see round, round. That is your foramen spinosum. This right here is your foramen spinosum. Right behind it. You can see it from the back side. However, you can see it much better from inside. So here, this butterfly-shaped bone that you are looking at, this is your sphenoid. And the part in the middle of sphenoid, this is your sella turcica. That is where hypophysis, which is pituitary gland, sits. So that is your sella turcica. Now, you see the ridge, and I'll show you. You see this little, that looks like fang, and then makes a margin on both sides. Little fang-like structures, and then make a little margin right here. This is your lesser wing. This ridge is the lesser wing. Do you understand? Now, kind of like a ditch, ridge feels like a little cliff, and then deep, kind of like a little drop, and then you can feel it in the base. This part is your greater wing of a sphenoid, that is making the base, not the margin, but the base of the skull. That is the greater wing because it's more area. Now, over here, I said you can see these holes right here. See this hole and this hole and the hole right next to the middle part. So what is the middle part? You see this in the center? This is the middle part. On either side, right next to the middle part, you see a very uneven edged hole right on each side of the middle part. That is foramen lacerum. This is your foramen lacerum. It is medial most. Do you understand? And right and lateral to it, you see a hole which is oval shaped. It is very oval shaped. You cannot miss it. This oval shaped hole, that is your foramen ovale. Oval shaped ovale. Do you understand? Lateral to it. And then right behind ovale, like its tail, at its tail end, you see this hole right here, right behind it. That is your foramen spinosum. Is that clear? Okay, so we did greater wing, lesser wing. Now we are going to look at optic foramen. Now, for optic foramen, that is going to get a little bit tricky, but we are still going to work on it. You are going to see it face front. So make sure the skull is facing you, the orbit is facing you, and then you see, okay, I am going to draw it on the side, okay? There is a hole in both orbits. And then underneath the hole, you're going to see a slit that looks like this and then like this. Like this. Like this. And then like this. So this is basically one orbit. This is the other orbit. And here is your nose in the middle. Understood? You see this hole? That is optic foramen. Optic nerve goes through it. So over here, you see this hole right here. And you can see it on this side. See this hole? That is optic foramen. Then you see a slit on the top. Oh, sorry, a slit right underneath it. That is your superior orbital fissure. See that superior orbital fissure? And this is your optic foramen. Now, optic foramen leads into a canal. Do you understand? So whether you call it optic canal or optic foramen, it's the same thing. Now, you see this on the bottom? You see this on the bottom, this slit? Huh? This is your inferior orbital fissure. That is your inferior orbital fissure. We did foramen spinosum, we did foramen lacerum, we did foramen ovale, we did not do foramen rotundum. The best way to catch rotundum is from the inside of the skull. So we are going to catch it right here. So right behind the superior orbital fissure, from the inside, you see this hole right there? See this hole right there? And there is one on this side too. That is called foramen rotundum. Rotunda, round. It is a very round hole. Do you understand? This is your foramen rotundum. And right behind it is your foramen ovale and foramen spinosum. And medial to the midline is your foramen lacerum. So you have lacerum, you have a spinosum, you have ovale, and in front of ovale and spinosum, there is only one hole in front of it, and there is no other hole in front of it. That one hole is rotundum, foramen rotundum. With that, we took care of the sphenoid bone. Now, we are going to look at the ethmoid. So ethmoid has let's first look at ethmoid. Where is ethmoid? So ethmoid you can see from the inside as well. You see this bone? And you're going to see it has a lot of holes in it. So on the inside, you can still see a bone with a lot of holes in it. See that? That is your ethmoid bone. Now, in the ethmoid bone, you see the holes, the part that has the holes in it, huh? That is your cribriform plate of ethmoid. So cribriform plate of ethmoid is a plate which has holes in it, an olfactory nerve. Brain is sitting in here. So olfactory nerve from the brain goes down and pierces through these and then hangs down in your nose. Do you understand? In your nasal cavity, and that's how you're able to smell. You know, this is the only nerve which is exposed to the outside environment. All the other nerves are covered with your skin, but this is in the outside environment. In your nose, it hangs down inside the nasal cavity so you can smell, and that is how you're able to smell. And that is why this is the nerve that gets replaced. Nervous system, if it is destroyed, does not get replaced, but this nerve endings, they do. Because if you are smelling, cleaning your restroom and smelling bleach, you're going to destroy those nerves. But that doesn't mean that you lost your sense of smell for the rest of your life. No, you will lose it for a couple of days and then it will regrow and you'll be fine again. You'll be able to smell your chocolate chip cookie once again. Okay, the next thing is crista galli. Now, do you see this ridge in the center of this bone? It is sharp ridge. If you slide your finger on top, you can feel it. It's a sharp ridge. That sharp ridge is called crista galli. Now, it is very important to know the parts and what bone they belong to. So they may ask you, name this structure at the pointer. You are going to say crista galli. Next question would be name the bone. And then you are going to say, oh, this is ethmoid bone. Do you understand? So that is how you can be asked questions. Now, the next thing is perpendicular plate. Perpendicular plate, you can only look at it from face front. So this, you are looking from inside the skull. See, this is inside of the skull. We cut it open, took out the brain, and then you can see this. However, if I have to show you perpendicular plate of ethmoid, I have to take you to face front. And in the nose. Do you see in the nose this area? Huh? Okay, in this area, now I am going to highlight it differently. You see this part up top, which is gray. I colored it green. And the lower part, I'm going to color it blue. You see this lower part? Okay. The top part, which is basically attached to the roof of the nose, the top part attaching to the roof of the nose, nasal cavity, that is your perpendicular plate of ethmoid. Oh, that would be your perpendicular plate of ethmoid. Below that, the lower part of this is another bone. It's a different bone, and that is called vomer. Now, those are facial bones, but I just wanted to show you that as well. This is vomer. So, what is this thing in the center? This thing in the center is your nasal septum. Do you understand? You hear about people having deviated nasal septum, DNS, and then they snore. So that is this nasal septum. And it is made up of two bones. The top bone is your perpendicular plate of ethmoid, and the bottom part is made up of vomer bone. Is that clear? So the nasal septum is made up of two bones. The top part is your ethmoid bone. Okay? And that is all for the bones of the skull. Now we are going to look at the facial bones. And the facial bone, what we are going to look at is this bone right here. See this bone with the teeth? This is your maxilla or the maxillary bone. Now remember, we are bilaterally symmetrical. So these were two bones. And then when we were fetus, and later on, right and left, and later on as we developed, then they fuse. You know, in the lecture, we talked about cleft palate. Cleft palate is when this does not meet, maxilla does not meet. That is when you get cleft palate. Okay, now coming back to the bone, this is maxilla. So the maxilla has, you see this wiggly part in which you have teeth attached. This is called the alveolar process. So this top area with the wiggly line, this is your alveolar process of the maxilla. Do you understand? This wiggly area of the bone, and you can see the little folds in it. That is your alveolar process of maxilla. Now, over here, also pay attention to this hole. Do you see these holes? These are your infraorbital foramen, pretty clear. Now we are going to turn it upside down and look on the underneath. Underneath means we are looking at the upper jaw. See the upper jaw? Now notice there is a line somewhere in the posterior 1/4. So this is 1/4, 3/4 here and 1/4 here. In the 1/4 posterior part, there is, you can see a line. Whatever is in front of that line, this entire area, that is the palatine process of maxilla, because it's making the roof of the mouth cavity of your palate. And this is considered as hard palate. In AP2, you will be taught hard palate and soft palate, and you'll be taught hard palate is made up of maxilla and palatine bone, and soft palate is all fleshy part. But anyhow, this part right here, this is all palatine process of maxilla. Over here, do you see this hole in front, right behind your teeth? That hole is called incisive foramen, which leads into incisive canal. Do you see this hole? That is your incisive foramen. Okay? And that is all for the maxilla. The next part is palatine bone. Now what we are looking at, we are now doing the facial bones. The first one was your what? Maxilla. Maxilla, look at it. It's facial bone because it's making your face. And facial bones you are going to we are going to study in the bones chapter that facial bones are classified as irregular bones. And look at it, these are very irregular, they do not have any shape. So if you notice, this is called maxilla, and the other one is going back to the roof of the mouth right here. You see this bone, gray colored at the back? This is the palatine bone. Now, understand the difference. This is palatine bone. This is palatine process. Understood? So here, this is maxilla, but this is palatine bone. So these are different bones, but this is part of the maxilla. So understand the difference between palatine process and the palatine bone. Palatine process, palatine bone. Do you understand? They are not the same, so don't mix them up. Be very careful with that, because they do ask sometimes this and people write palatine bone. No, this is palatine process of maxilla bone. This is palatine bone, and sometimes people write this for palatine process of maxilla. No, it is not. Okay. The next is zygomatic bones. Zygomatic bone, we are going to go to face front, because zygomatic bone makes your cheekbone, right? So you see this green area? I'm just getting rid of the color so that we don't get confused. You see this? Huh? Bone? And look at on the side. I like this bone. I don't know why. It looks to me like the state of Texas map. So, zygomatic arch. Remember we talked about arch? This is the arch. Now understand, arch is a shape. It's not the bone. The bone is zygomatic bone. Zygomatic bone makes the arch. So how does that fit? Zygomatic bone and temporal bone, they come together and this is the structure. The bone is the structure. However, what is this? This is the shape. That makes sense? Does it make sense? Arch is a shape. It's not a structure. So this right here, as you can see, this is zygomatic arch. That is made by two bones, by temporal as well as zygomatic bone. The two bones make the arch together. Okay? So this right here, and I'm going to color it. This right here is the arch. What is it made up of? It is made up of two bones, because I'm coloring in pink and green both. So this is zygomatic arch. And then there is zygomatic foramen as well. Now, in some bones, you may see it. In some bones, you may not, because these are molds and are kind of like not the best. But I'm going to show you around where you will find it. If this is the bone, you're going to find it somewhere here. Oh, let me use my. You're going to find it somewhere here. Zygomatic foramen. Sorry, not zygomatic. Oh, another thing. People often write it zygomatic foramen. It's not. It's zygomaticofacial foramen. And it's not zygomatic facial. It is zygomaticofacial foramen. So it's going to be somewhere there. And if you are looking face front, then this foramen, zygomaticofacial foramen, is going to be right here. Oh, and you know what? They did show it here. Yeah. You see this right here? This is zygomaticofacial foramen. You see where it is located? That is the only hole in this entire bone. So if they ask you name the opening or the hole and you see it's zygomatic bone, then that is the only foramen there. Do you understand? And now I am going to, I still don't like this. So I am going to go to the, I don't like that either. Okay, zygomatico facial foramen. Okay, let's see, because I want you to see. Ooh, I like that. Okay. Okay, look at that. See this hole? I cannot write on it, unfortunately, but look at my pointer. You see this hole? Zygomaticofacial foramen. See that? This hole? My cursor. And over here, you see this hole? Huh? That is zygomaticofacial foramen. Okay? And we are done with the zygomatic bone as well. Now we are going to look at the lacrimal bone. Or let's do the nasal bones first. You know these bones that you are looking at, this one? These are the nasal bones. These make the bridge of the nose, and your glasses sit on it besides your head. So the glasses are going to sit right here, and that is your nasal bones. Now, the front of the nose is gone because that was cartilage. When you die, it is gone. Now, behind this is your what? This is your maxilla. Remember? Huh? That is your maxilla. Behind that, do you see the green bone behind this? That is your lacrimal bone. Now, lacrimal groove is not something you can see that clearly. It is something you feel. So if you put your finger on this groove, then you are going to see, or you are going to feel that there is a depression over here. There is a depression right here. That depression is called nasolacrimal groove, and that leads into a hole right here, which is called the nasolacrimal, which is called the lacrimal canal. So this is your nasolacrimal groove in which the lacrimal gland, nasolacrimal duct is going to be sitting, and then it is going to drain right here. And then from here, your tears are going to drip down in your nose, and that is why when you cry, you sniff. So, how is the nasolacrimal groove and the canal? Let me show you. You see, you can kind of get a better idea right here. Do you see that kind of like a little depression here? That is nasolacrimal groove, and that leads into canal right there. Lacrimal canal. So let's see if we can find lacrimal canal. Lacrimal canal. Lacrimal canal in the lacrimal bone. Okay, now, ooh, I like that. That is what I was looking for. No. Okay. Do you see this depression right here? The pink one is the lacrimal bone. You see that lacrimal bone? The pink one. In that, you can see a depression that is nasolacrimal groove. And then right here is the lacrimal canal. Do you understand? And oh, another one. Oh, this is even better. Look at this one. This is your lacrimal bone. Do you see this depression? That is nasolacrimal groove. And you see this hole right here? Look at my cursor. You see this hole? This is your lacrimal canal. And all this is right next to the nasal bone. Look at this one. This is the nasal bone right here. This is your maxilla. And this is your what? Lacrimal bone. Now, the next thing is vomer. In order to see vomer, you can see it from the front, the lower part of the nasal septum. Remember, that is your vomer, this lower part of the nasal septum. But you can also see it from the back, this view. In this view, you see underneath the palatine bone, this is your palatine bone. Underneath it and in the middle, that is your vomer. This entire thing is your vomer. And outer to that vomer, you see this plate is the medial pterygoid plate. This one is the lateral pterygoid plate, right? Okay, so we did vomer. Let's see. In the facial bones, now let's go to our handout. Let's see what we did. Now we are on facial bones. We did maxilla. We did palatine bone. We did zygomatic bone, lacrimal, nasal, vomer. Yay, we did the entire skull. Now, we are going to look at the mandible. So let's look at the mandible now. Mandible is the lower jaw. Okay? Mandible is the lower jaw. Lower jaw. And I am going to show you that. Now, do you see this? This is mandible. You don't call it lower jaw because that is street language. You have to say the proper terminology, which is mandible. Now, in the mandible, we are going to look at a few things. So just so you know, if you look at it, it's L-shaped. Do you see that? The horizontal of the L, that is the body. Horizontal of the L is the body of the mandible. Do you understand? The vertical of the L, that is the ramus. So what is ramus? This is ramus. Do you understand? What is body? this is body. Do you understand? So if you look at the entire thing, it's L-shaped. Horizontal of the L is body, vertical of the L is what? That is your ramus. Do you understand? So it is shaped like an L. The bone is shaped like an L. Okay. Now the next thing is mental foramen. For that, you have to see the face front, because mental is Latin for chin. So in the front, this is the chin, right? Mental. The muscle attached to it is mentalis. However, these holes right here, these are called mental foramen because they are on the chin. Now, another thing we are going to look at are, so now we are going to look at the mental from the side, and I'm going to erase all this. You see this part? It's a pointy part. When you look at it, it looks like a shark tooth. This is your coronoid process. This is your this is your coronoid process. Coronoid process. Now, the next thing is condyloid process and mandibular condyle. Now, this is very important, so understand this. This part right here is your process. Process is always a structure that sticks out. So, this is your process. Do you understand? Condyloid process or condylar process. Condyloid process. You see the top part, the rounded part, huh? That top rounded part, that top rounded part right here, that is called the condyle. Condyles are always rounded because they make joint. So this is your mandibular condyle. Do you understand? The top part is mandibular condyle. So think of it like condyloid process is like your pencil. Condyloid process is like your pencil. Mandibular condyle is the eraser on top. Understood? So basically that is what these parts are. So we did mental foramen, condyloid process, coronoid process, mandibular condyle. Now mandibular notch. Notch is always a depression. So you see this depression right here? Huh? That is your what? Mandibular notch. So this is your notch. Its notch is you scooped out something, you're notched out. Mandibular notch. Oh, sorry. Yes, mandibular notch. And the last thing that we have to do is mandibular foramen. Now, for mandibular foramen, we have to look on the inside of the mandible. So let me show you that. So it was hard to look on the inside of the mandible. So what they did right here is, you see the cut end of the mandible right here? Huh? They cut the mandible so that you are only seeing half of the mandible because they cut this half. This half they cut. And then you can see they cut out the right half. Now you are looking at the left half of the mandible from the inside, from the oral cavity side. You see a hole right here? That is your mandibular foramen. Now I'll check if I can find a photograph of it, mandibular condyle from oral cavity. So let's see. Okay, mandibular foramen. Mandibular foramen from oral cavity. Image. Oh, voila! Ooh, I love Google. You all are so lucky you have Google. There was no Google in my times. I was a very, very sad person. So look over here. This is, you cannot find anything better than this. See this? Look at my, I cannot write on it, and that is driving me crazy. Okay, you see this hole right here? That is your mandibular foramen. Do you understand? And that took care of the mandible. Now, guess what? We are going to look at the teeth, and I like this, but I cannot write on it. Oh, well, so we are going to go back to our little thingy. Oh, I like this too. Okay, so this is the upper jaw. How many teeth do we have in our jaw? Entire mouth, there are 32. Yes, so there are 16 on the upper jaw and 16 on the lower jaw, and together in your entire mouth you have 32 teeth. Do you understand? We are looking at the half jaw, which means we are going to be talking about 16. Understood? Now, the 4 teeth in front, 1, 2, 3, 4. What are these? These are your incisors. Incisors. So sometimes on the exam they ask you the tooth as well as they ask you the function of it. Incisors are your cutting teeth. When you bite into apple, you're going to use your front teeth, not your side teeth. Otherwise you will look very odd. So you're going to use the front teeth. Those are your cutting teeth. People who have a cross bite, meaning their incisors don't meet, they have a hard time biting on the salad. Next to it, on either side, I'm going to use a different color because I can. And that is going to be your tooth, which is kind of like pointy. And you know, in vampires, they make it extra pointy in those movies. So those are your canines or cuspids, and you have one on each side, so you have 2. Do you understand? So how many incisors do you have? Incisors you have 4, and canines you are going to have 2, 1 and 2. Okay, those are your, oh sorry, those are your canines. So these are your canine, and or you can also call it cuspids. So 4 incisors, 2 canine or cuspids. Now we are going to look at premolars. So premolars are going to be, they are going to be the next ones. And that would be your 1 and 2. Do you understand? So in all you have 4 in one jaw. 1, 2, 3, 4. Now, incisors, as I said, those are cutting. Those are cutting teeth. Canines are the ones which are for tearing. So dogs, cats, they have canines. Dogs are called canines because their canines can really rip your skin. So what are these canines used for? They are used for tearing up the meat, for tearing. Those are called tearing. Oopsie, that should be in, my bad, green. That, what did I, okay, so canines are tearing teeth. The next is your premolars. So those are your premolars. And premolars are what? They are grinding teeth. Okay. And then the last one is going to be your, these 3 on each side are your molars, right? So 1, 2, 3, 4, 5, 6. Now, I am going to color the last one, because guess what? The last one is your wisdom tooth. Okay, so this is your wisdom that you get removed, wisdom tooth. And the other ones are basically your molars, and these are also grinding. Now, how many teeth do we have? Now let's see. And in 1/2, okay? So let's start with our incisors. We had 4 incisors. Then we had, and I am talking about half jaw. So let's put that there as well. Sorry. So I'm going to talk about half jaw. How many half jaw has? 16th. So 16. So we are going to start out and see if it adds up to 16. So incisors are 4. We are going to write the 4. The next is your canines. Canines are going to be 2. Premolars are going to be 4. And molars are going to be 6. So 4 plus 2, 8. 8 plus 4, 12. 12 plus, sorry, 4 plus 2, 6. 6 plus 4, 10. 10 plus 6, 16. And that is your total right there in each jaw. And if you talk about the entire oral cavity, then 16 plus 16, which is upper jaw, and lower jaw, you add those and you get 32. And that is how it is. Now, the next thing we are going to look at is the hyoid bone. Hyoid bone is a U-shaped bone, U-shaped. And it is present where the head meets the neck, right there. Where the head meets the neck, that is where you are going to find hyoid bone. Hyoid bone is the only bone that does not articulate with any other bone. It is held in place by the muscles of the tongue. Ear ossicles. Ear ossicles are malleus, incus, and stapes. And I'm going to do that. And then that is where I'm going to end. So let me show you the ear ossicles. Here are the good photograph of ear ossicles. You see over here, you see, follow my cursor. You see this one, this is malleus. It is shaped like a mallet like a hammer. You see this one, that is shaped like an anvil, and it's incus right here. And then this one right here is the stapes, which is shaped like a stirrup. This is stapes, and these are the 3 ear ossicles. And where are they present? I already showed you earlier when we were doing temporal bone. Remember, on the inside of the skull, you see this part right here. This is the petrous portion of the temporal bone. And this petrous portion of the temporal bone is what is holding your ear ossicles. And on the inner side of it, you can see it also has the internal acoustic meatus, but we already did that. Next class, we are going to do sternum, ribs, and vertebrae, and we are going to finish it off so you have enough time to go ahead and do the revision. I am going to stop the recording now. So just a sec. Okay, bye.